You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. And according to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have Firas Belbeisi. Dr. Belbeisi, welcome to the program.
Thank you very much. Thanks for having me.
And your patients call you Dr. B.
They do call me Dr. B. They call me Dr. B. It's a little bit easier than Dr. Belbeisi, but Dr. Belbeisi works, Dr. B works.
Okay,
Just don't call me honey.
Okay, good. Now, for people that don't know, and I know you brought a lot of photos, so we'll get to as many of those as we can.
Yes.
But for people that don't know your practice, like who's the typical dental implant patient?
Well, there isn't a typical dental implant patient, but they generally fall into two categories. Our first category is our patients that come in with failing teeth that are painful, gum infections, bone infections. They can't eat, they can't smile, they're embarrassed to smile. And those patients, they have an inkling, they know that, or they feel that they're headed towards a denture.
So they think they're going to end up in a denture?
They do. They think they're going to end up in a denture. And they're afraid that they're not going to be able to eat the foods that they want to eat. They're afraid that they're going to live in pain their entire lives with these infections, pain from these infections and pains from their teeth.
So what do you do for them?
For those people, if we determine that we can't save their teeth for them, then what we do is we give them a brand new set of upper and lower teeth supported by dental implants.
Okay, what's the second group of patients you see?
Our second group of patients is our denture wearers.
Okay.
Our patients that have had dentures for a really long time, 10, 15, 20 years sometimes, or even patients that have worn them for 6 months. And so our denture wearers a lot of times don't come into the dentist a lot.
They don't know their options.
They don't know their options. It's a case of they don't know what they don't know.
What could you do for them?
What we could do for them is, if we've determined that they're a good candidate for dental implants, we also give them a brand new set of teeth supported by dental implants.
So upper and lower teeth that don't come out.
That's right. They stay in place. They don't come out. You don't have to put them in a jar next to your bed. You don't have to take them out when you go to the restaurant and clean them. You don't have to put goop in them. They stay in place just like your natural teeth.
Do you think that's the future of dentistry, that, like, whether it's 20 years or 100 years from now, the dentures as we know them today won't exist? They'll all be attached to something?
Not only is it the future, it's the present.
Okay.
Hundreds and thousands of people across the world, across the United States, are doing this now. A lot of my patients are telling me, when they're doing this procedure, they're telling me that they wish they would have done it sooner.
But for people that don't know your practice, like who's the typical dental implant patient?
Well, there isn't a typical dental implant patient, but they generally fall into two categories. Our first category is our patients that come in with failing teeth that are painful, gum infections, bone infections. They can't eat, they can't smile, they're embarrassed to smile. And those patients, they have an inkling, they know that, or they feel that they're headed towards a denture.
So they think they're going to end up in a denture?
They do. They think they're going to end up in a denture. And they're afraid that they're not going to be able to eat the foods that they want to eat. They're afraid that they're going to live in pain their entire lives with these infections, pain from these infections and pains from their teeth.
So what do you do for them?
For those people, if we determine that we can't save their teeth for them, then what we do is we give them a brand new set of upper and lower teeth supported by dental implants.
Okay, what's the second group of patients you see?
Our second group of patients is our denture wearers.
Okay.
Our patients that have had dentures for a really long time, 10, 15, 20 years sometimes, or even patients that have worn them for 6 months. And so our denture wearers a lot of times don't come into the dentist a lot. They
don't know their options.
They don't know their options. It's a case of they don't know what they don't know.
What could you do for them?
What we could do for them is, if we've determined that they're a good candidate for dental implants, we also give them a brand new set of teeth supported by dental implants.
So upper and lower teeth that don't come out.
That's right. They stay in place. They don't come out. You don't have to put them in a jar next to your bed. You don't have to take them out when you go to the restaurant and clean them. You don't have to put goop in them. They stay in place just like your natural teeth.
Do you think that's the future of dentistry, that, like, whether it's 20 years or 100 years from now, the dentures as we know them today won't exist? They'll all be attached to something?
Not only is it the future, it's the present.
Okay.
Hundreds and thousands of people across the world, across the United States, are doing this now. A lot of my patients are telling me when they're doing this procedure, they're telling me that they wish they would have done it sooner. And people with bad teeth a lot of times have bad experiences at the dentist.
Okay.
They have failed root canals, they have infections, they have gum infections, bone infections, pain, they have trouble eating and chewing. A lot of them tell me they've had bad experiences, and that's kept them away from the dentist. And so they have a fear of the dentist. And so same sort of thing. They fear that the procedure, that what we're going to do for them is going to be painful, and they're afraid of it.
But it does seem painful.
Well,
I mean,
that brings me to the next point. Yeah,
that
that brings me to my next point. A lot of them have fear or anxiety. And so I assure our patients, a lot of our procedures, these procedures are done under IV sedation.
Okay.
I bring in, a side note, I bring in an anesthetist to do my sedation for me. So I have someone monitoring our patients. Safety is the #1 priority for us. So I have our anesthetist focusing on the oxygen monitoring and the heart rate and everything that's going on from the anesthesia side. So patients not aware of what's going on, they're under IV sedation. The anesthetist is handling that. I'm handling the surgery. I handle my job, they handle theirs. You know, Randy, there are a lot of practices where the practitioner or the surgeon is doing his own sedation, and that's perfectly fine. What works better in my hands and in my practice is that I bring in an anesthetist, the anesthetist handles the anesthesia, I handle the surgery.
And when it's all done, do they ever say, like, I worried so much about this and I shouldn't have?
All the time, all the time.
Like, it's easier than they thought it was going to be.
It is. It's easier, and we are with our patients every step of the way. So we let them know about what the procedure is going to be like beforehand, during the procedure, and after. And so when they get that sense of calm, they get a sense of that we're with them.
Now, when you're going to do this, do the patients get a say-so, or can they get an idea of what they're going to look like when it's all done? Like what their teeth are going to look like?
They absolutely do. So we have a process. We're able to digitize our patients.
What does that mean?
And so what that means is we use a fancy piece of technology that creates a 3D version of our patients. And then we go through a smile design. A lot of my patients will bring me pictures of what their smiles looked like before they lost their teeth or when they were happy with their smiles.
Okay.
And they ask me to duplicate that. So me and my lab technicians sit down and we get input from the patient, and then we do a 3D rendering of what the smile is going to look like in their face.
And you show them.
So it's very custom.
Do they ever say, I want that?
They do. They do. A lot of times they say, Doc, I trust your artistic eye.
Are they surprised sometimes?
I think they're surprised by how accurate and beautiful it looks. I think that a lot of people can be skeptical because the unknown can be scary.
It changes their appearance.
Absolutely, 100%.
So what do they like more? What they can eat or how it looks?
I have patients that fall into both categories. Okay. I had a gentleman the other day that came in that said, all I wanted to do was improve my smile and how it looks. Lo and behold, a few months later, after he got his teeth, he's saying, I'm enjoying everything that I can eat now with my teeth.
Could they, are they limited? Like, for example, could they bite an apple with their front teeth, or they have to be careful? When they're all healed up?
They can eat apples, they can eat corn on the cob. That's a big one that my patients tell me.
What's their favorite? Like, what are they? I
get corn on the cob a lot. Okay. A lot of people like eating corn on the cob, especially in Michigan, with all the corn and all that. That's really important to them. Apples. A lot of patients tell me they can eat steak again. And so I joke all the time with them. I tell them, your first steak meal, your first steak dinner is on me. It's not a joke because we actually do it, but it makes them laugh.
Do they send you a photo?
They do send me photos. They do send me photos, absolutely.
What do they say when they see their teeth for the first time, their new teeth?
When they get the mirror and it's revealed to them and they're able to see their teeth for the first time, a lot of them will start crying.
Really?
A lot of patients are so happy, they're ecstatic, and it's tears of joy, okay? They like to see their teeth, they like to see themselves smile. A lot of these patients haven't smiled like this in a really long time. And so it takes them back.
When you say really long time, like 10 years, 15 years?
I'll say decades. I'll say decades because it reminds them, they'll tell me that it reminds them of a time when they were happier, when they were more youthful, when they were livelier, when they were able to smile with confidence. And so a lot of our patients have been suffering for a long time not being able to smile like this.
You say it's life-changing.
When they say
How so?
Well, when they say it's life-changing, what they mean is that they're able to go out to restaurants and eat foods that they haven't eaten in a really long time. They're able to eat salads. They're able to eat steak.
Seems like salads would be an easy one to eat.
Well, that's what you think, Randy, because you have teeth. If
When
you
you
didn't,
have bad teeth, you can't eat things like that.
not when you're in pain.
Okay.
You can't eat steak. You can't eat pizza and bite into a crispy pizza. When you're able to have teeth and eat without pain, you're able to you're going to travel more. You're going to go out on vacation.
Okay.
You're going to go to Italy and
they tell you
sample
this?
yeah, absolutely, all the time, because they want to enjoy their lives. They start to become more social. They're smiling more. They have more friends. They are more sexually active. They're having a better relationship with their partners. These are things that patients tell me happens to them all the time.
Correct me if I'm wrong. The way dental implants are typically done is you go to one doctor that puts the implants in, and then you go to another office where they put the teeth on top and then maintained elsewhere. You do all three parts. Is that why you do it so quickly?
That's right, and we used to do it that way as well. But what we felt was, we heard from our patients,
Okay.
and what they told us was that they wanted to get everything done with us in-house. What we used to do is we used to have to bring in another surgeon, a different lab technician, another professional after that. Instead of doing all of that, we just cut out the middleman. And so we're able
Okay.
to handle a lot of that in-house.
So after dental school, you learned the surgical procedure.
That's right. I learned the surgical
You said
procedure.
you traveled out of the country to learn implant dentistry.
Yes.
Is that right? Is
there
there
are,
that much to this?
Well, there are a lot of different ways and a lot of different techniques. And if you can pick up different pearls from different practitioners from all over the world, I think that's going to benefit the patient at the end of the day.
Okay. And how old can you be to get this done?
I have colleagues that are doing this procedure on patients that are over 100 years old. My oldest patient was in her 90s.
Why would a 90-year-old want to do this?
Well, Randy, if you get to be 90 years old or 100 years old, what you want to be able to do is enjoy your food. You want to be able to go out to restaurants. You want to be able to hang out with your friends. And you want to go and travel. So if you're going on cruises, you don't want to worry about a denture being
So
with
what do you do for your 90-year-old?
We brought her in. We determined if she was a candidate for upper and lower teeth supported by dental implants. We designed her smile. And then the next step after that was she got her teeth. And now she's sending me postcards from all around the world, from all her vacation cruises that she's doing.
Right? Because you told me on the phone, you said, Randy, they look so much better. And I thought you were exaggerating, but it's obvious.
These things make a difference in these people's lives. When you're able to go out and you're able to enjoy your life at restaurants with your friends. I have a lot of patients that when they smile and when they talk, I had a woman the other day come into my office. And when she was talking to me, she was holding her mouth, her hand up to her mouth. Because
even at the dentist?
Even at the dentist.
They're ashamed of their...
And for me, that's what gets me. Because I tell them all the time, this is a judgment-free zone. We're not here to judge you. I'm here to be your guide. If I can help you and make your life better, that's what I'd like to do.
But if you have bad gums, will the implants still stay in there?
Well, when we go in and we determine that our patients are good candidates for implants, when we do our surgery, we're removing all of that periodontal disease, all that gum infection, that bone infection. All of it is gone. So bad breath goes away. The infections go away. The headaches go away. A lot of my patients that have gum infections tell me they have headaches. They have digestive issues. All that
because
infection,
they can't chew their food.
Because they can't chew their food, but the infection is pumping through their body. We know that this bacteria is getting to your heart, it's getting to your gut, and it's making people sicker. Once we remove all of this stuff, it's gone. It goes away.
So is this one of those things when it's all done, he goes, man, I should have done this years ago?
100%. 100%. They wish they would have done it years ago, and they're also mad at themselves because it held them back. Something held them back.
But back to the denture wear. I mean, if you've been wearing a denture for, let's say, 10, 15 years, I guess you don't have enough bone to do this.
That's just not true, Randy.
Not true?
That's old thinking. Right now, with the technology that we have, the techniques that we have available, we can build bone, we can use specific implants, we can position these implants in specific places to be able to get the results that we want. And people are getting this procedure done all the time.
So when I have a dentist that will say, but Randy, if they have limited bone, many people can't do this. Is it just based on training of the dentist?
It could be based on training. It could be based on the technology. I mean, we use 3D CT technology to be able to plan and see what our bone looks like before we do the procedure.
You told me within, I'm paraphrasing slightly, but I think you said like within 100 miles, you have the most advanced implant center.
I would say so. I mean, we've
right?
done the research. I've looked at what other practitioners have and what other dental offices have, and we're right up there with the best.
When they have it done, what do their friends say?
My patients tell me that their friends are so excited for them. They're happy to see them smiling. Smiles are contagious. And they're a lot more attractive than frowns. And so when you're smiling, you're happy, you're making your friends happy, you're making your family is happier. You're getting out there, you're more social.
Okay. You make it sound so good, by the way. But you see it every day. Right?
I see it every day. I get both sides of it. I see what patients or people looked like before they have procedures like this done, before they have a new set of teeth, and after. You know, when they're coming in, they're hopeless. They're miserable. They're telling me they can't eat.
Hopeless meaning without hope. They don't think anything can be done?
They can't. They think that it's over for them. And I have to rein them back in, and I have to tell them, we're here for you. We're going to be with you every step of the way. Here are some options. And so one of the things that we do for our patients is we share these stories, right? We share these stories with other patients.
Yeah, because you're all over like Instagram.
All over Instagram, Facebook. You know,
I did look at your videos on your website. I mean,
it's full of
it's a
amazing
big
stories
deal.
and amazing patients just like Erica.
Now we're out of time, but you know, cost. I guess even the best dental insurance doesn't really cover it. Medicare, Medicaid doesn't cover it. You say people finance this.
That's right. People finance this, and I'm going to draw from what my patients are telling me. We have tons of financing options at our office.
Okay.
Patients are also telling
You
me
have to have okay credit. Is that correct?
you do. You have to have okay credit.
Could you get a cosigner?
You could. You could get a cosigner. There are other options.
Now I got to ask you about this. It's in my notes. Snap-in dentures.
Yes.
You're not a big fan of these snap-in dentures.
Yeah, that's right.
Because I see them all over the internet.
Yeah. The key
Why?
word
Why
is
don't you like
the
them?
key word is that they're a denture. Okay. They're still made out of plastic and they still are removable. We've done them. We've done them for patients, but they're not as happy. They come back, they have to get adjustments done, and nobody wants to keep going back and forth.
So they do what, to save money at the beginning, but in the long run it's more?
That's right. It's more because it's costing them, number one, in satisfaction. So they're not as satisfied as my patients that are getting fixed.
Why is the trend that a lot of the new guys are doing these snap-in dentures?
Well, they think it's easier to do. They think that's what their patients want, but they realize that their patients don't actually really want that. What their patients want is to be out of pain. They want to be able to chew what they want, and they want to be able to have teeth that act and look and feel like their natural teeth.
Don't come out.
Dentures don't do that. And so at the end of the day, these snap-in dentures are just dentures.
Final message. We're out of time. Two groups of patients you talked about. They still have their teeth, but they're bad. Maybe they've been told they need a denture. The other group are the people that are actually wearing a denture. They've heard what you have to say, but they're still skeptical. What do you say to them?
I invite them in. Come in and meet us. You answer any questions that you may have. We'll even go over financing. That's not a problem.
So know your options.
Know your options is the bottom line.
Now, do they always see you at some point on the consult?
They do, yes. They do see me.
So if they want to make an appointment, do you prefer they just go online, make an appointment there, or just call your office?
Whatever's easiest for them. If they want to go online and make an appointment, request an appointment, we can reach out to you. If you want to call us and make an appointment with us, we're happy to see you.
Okay, good. I want to thank you for coming on the show. Good stuff.
Thank you, Randy. I appreciate it.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.